Claudia Lennhoff is joining me today for the Community Planning Conversations. Claudia is Executive Director of the Champaign County Healthcare Consumers, or as some of you might know it, CCHCC. Claudia, thank you so much for coming and joining me.
Thank you.
Before we get too far into our conversation, just for truth in lending here, I did want to share with the viewers that when I was working on my master's, a classmate of mine, Mike Doyle, and I were in the class that was the basic foundation for the establishment of this organization, and now it's under the fine directorship of Claudia.
Thank you.
Claudia, there is so much to talk about in what is happening in our community concerning the intersection of healthcare and community planning. I'm sure many people don't think that there is this intersection, but it certainly does exist. And I just sort of like to start with you talking about an overview of what you see happening in the Champaign-Urbana and Champaign County area related to healthcare, and then that will lead into many of the other topics that are going on here.
Okay. Well, I think one of the things to start out talking about is the fact that Champaign County is actually a fairly unique county in terms of how our healthcare system is structured compared to other communities around the state and around the nation. First of all, most of the healthcare providers are concentrated within the Champaign-Urbana metropolitan area. And one of the things that's very unique about Champaign County is that over 90% of all of our community's physicians are located in two major group practices. So over 90% of all of the doctors in Champaign County work at either Carle Clinic or Christie Clinic. This is a very high proportion concentration of physicians, and I haven't found another community that has this kind of concentration. Most communities have multiple physician group practices, and most group practices have between 6 and 13 physicians. So when you have two clinics that are for-profit that essentially have hundreds of physicians there, it's a very unusual situation. And this actually brings me to a topic that I wanted to talk about, which is that our community right now is facing a crisis of access to primary care for about 40% of our county's population, precisely because of this concentration of physicians. Our county's population is approximately 186,000 people, and we have about 21,200 or 300 people who have Medicaid, and we have about almost 55,000 community members who are uninsured. So
55,000.
Yes, who are uninsured at a given point in time. Some people cycle in and out of insurance depending on their jobs, but more and more people are losing insurance because more and more businesses and so on are not able to offer insurance to their employees. So nationally, of course, we have a growing number of uninsured people. Locally, we're no different, and we have a large number of small employers in our community who are not able to offer insurance, and those numbers are stunning. But
that's 30% roughly.
Yes, and between the Medicaid population and the uninsured population, it's almost 40% of our total county's population who is.
That's a tremendous burden.
Yes, yes, and the hardship comes with the fact that Carle Clinic and Christie Clinic both have similar policies of refusing or limiting care to people who have Medicaid or people who are uninsured. So we have a huge...
So there's no safety net.
There is no safety net. There's a tiny, tattered safety net. There is a little bit of access through Francis Nelson Community Health Center, but Francis Nelson has been so overwhelmed because all of these folks, if they need to go see a doctor, they can't get an outpatient appointment. So they either have to end up going without health care, going to the emergency room, or trying to get into Francis Nelson. Francis Nelson Community Health Center.
Yeah, let's stop to catch people up on
Okay.
and on two things that you brought up, which are very important. One is, can you briefly talk about the rules of the road or criteria that both Carl and Christy use on giving any help to those who are uninsured? And then the second is just briefly talk about what Francis Nelson is and the move to their new facility. Okay.
Well, Carl and Christy Clinic basically have publicly stated that they are no longer taking any new Medicaid patients, but in fact, we have a lot of consumers who call our organization. They call our consumer health hotline, and they are established patients who have Medicaid, but when they call to make an appointment and they're asked what their insurance status is and they say they have Medicaid, they are being refused appointments. And this also is happening to Medicare beneficiaries. There are some people who have Medicare as well as Medicaid, and these are low-income people. And
Elderly.
Typically elderly or people with disabilities,
Right.
but overwhelmingly elderly. And they are people whose primary insurance is Medicare. Medicaid comes in and picks up the part that is their responsibility after Medicare, but that they cannot afford to pay. And even those folks are being frequently refused appointments just because of the mention of Medicaid. And so, the policy publicly stated is that Carl and Christy simply are not taking new Medicaid patients. But the reality that we see is that if you have Medicaid and if you're not already a very well-established and regular patient, you're not getting access. We don't believe that it's just new patients whose access is being limited. Uninsured patients also have a hard time. If you call to try to schedule an appointment and you don't have insurance, you may either be refused the appointment or you will be asked to bring, a sum of money to the appointment that frequently for people is unaffordable. And uninsured patients get charged the highest price in healthcare, which is the sticker price that nobody else pays. So,
It's a catch-22.
It's a catch-22. So this is part of the problem. And, primary health care is, when you're not feeling well and you need to go see the doctor, and it's, outpatient care and so on. And Carl and Christy Clinic have, again, 90% of the physicians. Now, Francis Nelson Community Health Center is what's called a federally qualified health center, which means that it gets some funding from the federal government to serve the medically underserved people in our community. And Francis Nelson is a tiny, wonderful facility, but when Carl Clinic and Christy Clinic started limiting and denying appointments to uninsured and Medicaid patients, Francis Nelson became overwhelmed. It's sort of like taking a huge ship and dumping the people from the ship onto a tiny lifeboat. Most people don't make it onto the lifeboat. And Francis Nelson has been struggling to do the best that they can, but basically at a certain point, their waiting list to get an appointment was as long as 10 to 12 months. And so they just said...
Boy, that sounds like Section 8 housing almost, doesn't it?
Yeah, and they just
wait
said,
list.
This doesn't make sense. This is almost just cruel, and it doesn't make sense. And if you think about it, if you think you have bronchitis or you're sick somehow, and you call to make an appointment, and you hear that it's 10 months out, it's ridiculous. That's of no use to you. So Francis Nelson, in order to deal with the crisis, has set up some referral networks where they're able to get some people in through the emergency rooms, or they work with public health. They also work with us where sometimes we can get people in for essentially urgent care appointments is what it turns out to. But it doesn't meet the need. We have people who contact us who have been through the emergency room. Maybe they had trouble breathing. I had one client who had trouble breathing, and in the emergency room they did an x-ray, and it looks like there's a cancer. And then they were referred outpatient to one of the clinics, and they had Medicaid and couldn't get an appointment. And, we're hearing cases like that all the time, cases of people who have an injury and they need some kind of corrective surgery. They're not able to stand. Perhaps their knee is injured and they're not able to stand, and they can't get the surgery that they need. We've seen people lose their jobs. We've seen people on the brink of losing their homes or their housing. It's not unusual at all in this community. And
Actually, just to insert, when I teach about social planning and I teach about poverty, there's three ways, and one of them is just what you're describing, that these may be very hardworking people, but because of exigent circumstances, you lose your income,
Yes.
and then you are put in this very precarious
Yeah.
financial situation. You could have cancer and treatments and run out of your health care, or it gets canceled, and then everything ends up being taken away
Yeah.
from you financially.
Yes, and it's tragic. I mean, it's tragic. And nationally, we know from the Institute of Medicine produced, these incredible reports over the last couple years where they ended up coming out with the recommendation saying we need universal health care in this nation. And they looked at the life expectancy and the morbidity rates of people who are uninsured. And of course, people without insurance tend to get less health care. They tend to get it later than they need it, and therefore their outcomes tend to be worse, and their lives tend to be shortened. And I can talk about those studies and the statistics, but we see it day in and day out with real people. And I've been doing this job for 9 years, and I can tell you that the last year and a half to 2 years since Carle Clinic and Christie Clinic changed their policies and basically blocked access.
And that was about how long ago, roughly?
That the crisis began around March 2003.
Okay.
Actually, longer ago than what I was thinking. And it started when Carle Clinic stopped taking new Medicaid patients, and then Christie Clinic started the same thing around that time. And some of it was for psychiatrists and so on, but it just sort of expanded. And so at first the crisis was among a certain type of patients who needed certain types of care. But then it just has expanded, and it's truly tragic. And we have been doing some organizing around this and trying to bring providers together and community leaders, including elected officials. And people's first reaction is, well, isn't Medicaid a problem and a crisis everywhere? And isn't the rate of uninsured a crisis, anywhere in this nation? And it's true, but we have unique factors in our community that make it worse than in any other community. And I have the good fortune of being able to work with people from organizations around the state and around the nation. And I have asked people if they've ever seen a concentration of physicians like what we have here, and then a magnitude of crisis, this large. And everybody says, no, this is a unique situation in Champaign County. Medicaid rates are bad for the entire state of Illinois. The state of Illinois needs to make improvements to Medicaid in terms of what they pay and how quickly they pay.
Yes.
This is a problem for healthcare providers. It's a legitimate problem. But there's no community in the state of Illinois where 90% of the physicians, refuse or severely limit access to Medicaid, for Medicaid patients.
Why are we as a community, in your experience and your judgment, allowing this to continue?
Well,
why aren't we beating down the doors? I'm talking about metaphorically here.
Sure.
Beating down the doors and saying,
this is unacceptable.
This is very unacceptable for the health, safety, and welfare of our community.
Well, I think Champaign County healthcare consumers is trying to educate the community about this, because we think that when the community learns and understands this, they won't stand for it. Part of the reason it's even possible to do this is because that it's possible for Carle Clinic and Christie Clinic to do this is because they are for-profit healthcare providers. They can make a lot of the rules, whereas if they were a nonprofit healthcare provider, they would have less latitude in saying
because
who
of
they
federal
would.
guidelines is
Federal
what you mean.
guidelines and tax exempt status and so on.
Okay.
I know that it's not just us who are upset about this. Social service providers are upset about this because social service providers who are working with their clients and trying to help them move on are having their clients hampered because of an unaddressed healthcare problem. This problem even impacts small innovative programs that we have in this community. Like we have the drug court program that if people are able to enter the drug court program under Judge Ford, they are able to be diverted from prison, and they can rebuild their lives and move
there's a
forward.
huge cost saving for the community.
Yes, it's a beautiful program, but I cannot tell you, we've had so many people contact us, usually through Prairie Center, where they work with the clients, where the client cannot get into the drug court program, because when you get into the drug court program, you can't take any kind of substances, and you can't take, opiate-based drugs that are painkillers, for example. And there are so many clients who have an oral infection, an untreated oral health problem, and in order to get them treatment, you have to prescribe them antibiotics and usually pain medication until the time that they can get the treatment. Well, Christie Clinic and Carle Clinic oral surgeons won't take Medicaid patients and won't take uninsured patients unless they can pay full price up front. And so there's a lot of people who have untreated oral health problems who are sort of getting by on antibiotics and painkillers, which isn't a good way to get by. But this is a problem if you want to be in the drug court program. And we've actually seen a few people who were eligible and who could have otherwise qualified for the drug court program, but who couldn't do that because they couldn't get health care when they needed it and have their health problem addressed, and therefore had to, get pain medication through the emergency room to get them by.
Which again then costs so much more to do it through that mechanism.
Yes.
And it would save the whole community a great deal of money to do it in a much more efficient manner.
Absolutely. And actually the hospitals are very concerned about this problem because precisely for the reasons that you say, they're seeing people now seeking primary care through the emergency rooms.
Right.
And we got some data about the increase in the number of uninsured and Medicaid patients just in a 1-year period, which was fairly stunning at both of our hospitals. And one thing that we're doing, actually, if I can point people to a petition that we have here. This is a petition, if people care about this issue or they're concerned about it, this is a petition that people can sign on to or have their names added. It's on our website, or people can just call us at.
And the web address will be back up on on your TV monitor.
Oh, thank you. And the petition just basically says that as community members, we are concerned about Champaign County residents' timely access to affordable health care services. And anybody who signs a petition is basically calling on all local, state, and federal government officials and elected representatives who serve the county, and on all local healthcare providers, including Carle Clinic and Christie Clinic, to work together to do their fair share to serve Champaign County's uninsured residents and Medicaid beneficiaries. And basically what we want to do is, with this petition, if we need to go and talk to the state to try to encourage them to work out a better Medicaid reimbursement rate, we can go and show the support of the community. If we need to go and talk to Carle Clinic or Christie Clinic, we can go and show, that there's support, from the community. So this petition is not a legal document. It's just a show of support. And if people want to have their name added, all they have to do is contact us. And if they want to help beyond that, they can help carry petitions and get other people to sign them. And then we will be having meetings about this in the fall. But I think people should expect to see this heat up because we're in an unacceptable and unsustainable situation, and the damage to the individuals is obvious, but the damage to the community will start to be felt very soon. When you have employees going to work and then missing work because they can't get their healthcare problem treated, that affects the employer, it affects all of us.
Well, and an urban planner would look at it and say this affects the livability of our community. Maybe not you and I directly because we're covered by health insurance, but it's the whole tone of our community. Are you all present at the farmers market? Would people see, have the chance to do this? The academic in me always creeps out here, and I was just thinking what a wonderful master's topic this would be for somebody in health administration to look at the economic efficiency costs and the increase of it because of this inefficiency as compared to if just taking the few suggestions you have laid out and maybe others that you haven't had time to talk about and just look at the costs saving, that alone would make the argument
Absolutely.
on what we should be doing within our community.
Absolutely. That's
Yeah.
absolutely right. Now,
So any health administration student out there, here's your master's
sure,
topic.
I'd be willing to help with it. And that brings me to another topic along the lines of what you had asked about and talking about community planning and so on, is, the recent announcement about the expansion of Christie Clinic.
Does that put another burden on folks to be able then to avail themselves of this
Yes.
healthcare facility?
Yes, and one of the things that I wanted to say before I got into that is earlier when you were asking how is this possible and how can this happen, when we talked to Christie Clinic about the crisis in access to care, and we said, why won't you take Medicaid patients, especially the state has just increased the reimbursement rate for pediatric Medicaid services. And they've increased it to a rate that I think is comparable to what Blue Cross Blue Shield would pay.
Oh, okay. So
for
some of
basic
that
services.
argument then has been removed.
It's taken away. But what Christie said in response was that they basically cannot afford to take care of Medicaid patients. And that was a couple months
Do they mean afford in actually a financial
Financial.
sense, or are they talking about time, or is this just a camouflage that they don't want to?
I think they were talking about in a financial sense.
Okay.
And yet, and somebody hearing that might think, well, they're financially struggling and so they're making decisions about who to serve. But clearly, Christie Clinic is not financially struggling. They have just announced, first of all, they built a radiation oncology center on their campus in downtown Champaign. Now, that radiation oncology center is completely unnecessary and completely duplicative, because Provena Covenant Medical Center, which is the hospital that has corresponded with Christie for many years, Provena Covenant had actually just built a radiation oncology center for the Christie physicians on the Provena campus, I think about 5 years ago.
So have you been able to ferret out an explanation of why there's this duplication? Because one of the things of the law that was the precursor to Champaign County Healthcare Consumers, the Health Systems Agency Act, one of the things in that act was to help minimize this kind of duplication and to create an environment for medical facilities, be they hospitals or clinics, to do a bit more sharing rather than everybody buying a CAT scan or an MRI.
That's right. That way we have the resource that we use them more wisely, and we don't waste them on duplicative facilities or equipment.
Right.
And there's a little loophole in the certificate of need process.
Okay.
That's the process that where a provider has to go to the state and say, we want to build this facility or this thing. And the loophole allows providers to build radiation oncology centers without any oversight or any certificate of need process.
I see.
So for some reason, that's how that slipped through, but it's definitely duplicative. And I think the question for people to ask is, why would Christie build that when a perfectly good one already exists at Provena campus, and it's taking business away from Provena?
Plus, it took money out of the budget of Christie.
Sure,
to
when they
build
could have been
this.
serving Medicaid clients or
Or
uninsured patients
using
or
it
doing
in
other things.
Other things with the money.
Yeah.
Yes.
And then now they just recently announced a massive expansion, a planned expansion of expansion and relocation of Christie Clinic, where Christie Clinic is going to move to the area of the intersection of I-57 and I-74. And from a community perspective, there's a number of reasons why we need to be very concerned with that. First of all, the moving of the facility is going to affect access for people. There's not the same kind of transportation access that there is in downtown Champaign. Many people go to Christie by bus, and that they get to
certainly do.
downtown.
And many buses service because of the transit center being nearby.
Yes.
Yes.
Now, it's possible that Christie will arrange with MTD to have a line, bus line to come out there. I would certainly think that they need to try to do that somehow, but it is going to be an access issue, for people. I think it's also, I think one of the things that very much concerned me when I read the newspaper article about that is that Christie said that they were being strategic and locating at the crossroads of these two major highways because they wanted to serve their patients from the surrounding communities.
Mm-hmm.
And as a community member here, I felt rather outraged to hear that, that there is sort of a lack of concern for the local community.
The surrounding community trumped the local community.
Yeah,
Mm-hmm.
and
Mm-hmm.
in the midst of this crisis. I mean, this is a really significant crisis. And I think, people need to be concerned about that. And I think the other thing that that is a very real concern is that Christie Clinic wants to also build an outpatient surgery center. Now, that surgery center, if it's built, and I believe it'll have to go through a certificate of need process, which means that the state will probably hold hearings in our community,
Mm-hmm.
And we'll give an opportunity.
Public hearings.
Public hearings,
Nice.
thank you. And we'll give an opportunity for people to speak their concerns. And we will certainly be watching that and notifying people about that, and we will be there speaking our concerns. And our major concern about Christie's plan to build an outpatient surgery center is that a lot of those surgeries currently are taking place at Prevena Covenant, and Prevena Covenant would be losing approximately 6,000 surgeries a year to this new facility. And the reason that people need to be concerned about that is because Prevena Covenant is our nonprofit, hospital in our community. And the way that a hospital survives financially is that, because a hospital cannot turn anybody away through the emergency room. Anybody who comes to the emergency room must be assessed and must be stabilized, appropriate to, what brought them there. So a hospital performs many functions, and some of those functions are revenue-generating functions. And those offset the money-losing functions that a hospital performs. Mm-hmm. There's a lot that happens in a hospital. There's certain procedures, certain types of patients, certain conditions that, when the hospital delivers treatment for those things, they end up losing money for that. But they can do that because they do other things that actually generate revenue for them that offsets the cost of doing these other things. And, it feels like Christie, with the Radiation Oncology Center, taking away that business from Prevena and then now building this, or wanting to build this outpatient surgery center, it feels sort of like Christie is slowly strangling or cutting off the revenue generating functions that Prevena Covenant does. And that should concern all of us, because everybody in this community really needs to care about us having two nonprofit hospitals. We
Choice.
Well, and it's not just choice. We actually need that. We need those two facilities in order to meet the need of this community and the nearby surrounding communities. We're a central healthcare provider for many communities. Many communities around us are rural communities. Some of them have small hospitals, but some of those hospitals don't have the capacity to do what some of our hospitals do. And so for all of our health, we really need to have two viable, strong, healthy nonprofit hospitals. And when you have this ugly competition between a physician clinic, and a hospital, where the clinic is aggressively trying to duplicate functions that the hospital has been serving, it can be very dangerous. And I can say that when there are public hearings for this outpatient surgery center, healthcare consumers will be there opposing the creation of this outpatient surgery center for that reason and many other reasons, along the lines of what we talked about, but primarily because we think it will be really harmful for our local hospital.
Did the healthcare consumers have any chance to have input about the siting of the new Christie facility at all?
No, people don't consult with us for.
Well,
for that.
there were no public. No public comment time like that in conjunction with this.
No, I think this was a business deal, arranged. I mean, it was Christie's business. They came up with a plan. They clearly are working with Atkins on, the location and some kind of I'm not sure what the arrangement is with the land, but it looks like some kind of exchange of land or something. But because they're a private, for-profit institution, they can conduct business that way. Now, where the public has a chance to have input is around the certificate of need process, where there will be public hearings. That's where we get to have our input. However, ideally, if the intent of Christie had been, how can we use our resources to better serve the community, whether they're for-profit or not for-profit, they could have been talking to the community and saying, what are your needs? How can we better serve you? Here's what we're thinking about. There could have been a process like that. There's nothing to prohibit that process.
But
that's
there's
not
no
what happened.
guidelines or federal law
that requires
mandate it.
No.
Okay. When you were talking about that location, I have heard some people sort of express concern. Well, and I'll use an example. It takes me from my home, and I lived between two of the major bus lines, 45 minutes to go to Marketplace.
Mm-hmm.
Well, it would not be an unlikely same amount of time when and if MTD services out to that area. And I'm just trying to imagine that kind of trip on the bus if I'm not feeling well, or I'm elderly, and then I have medications that I have to try to get, or I have to get back for test results. So concern being expressed for just the sheer accessibility of it.
Yes, I mean, that's a very real concern. Time and distance traveled is known to be a barrier in healthcare access. People who study healthcare access have looked at the barriers of the amount of time that it takes to get to where you need. And it's not because people don't have time and they're too busy. It's precisely because of what you're talking about. If you are feeling sick, if you're not feeling well, and you have to contemplate going for an hour, or 45 minutes and changing buses or doing things like that, it can be physically exhausting. And, so it's
Do you have emphysema? Any heart problems?
Yeah, it's a hardship for people. So time and distance, are very well known to be barriers in healthcare. And so when people, from a community health planning perspective, when people are looking at how to best serve the communities, what you hear them talking about is locating healthcare where the people live, or finding ways to take healthcare to where the people are. There's different kinds of services that you can actually take to neighborhoods or to homes, but also when you need people to come into a place, it makes sense to have it centrally located for the community you are trying to serve. It just makes sense. It's where the rubber meets the road. It's common sense. It's day in and day out experience. It's the right way of doing things.
Well, planners always think that all services should be at the hub of the wheel, because that makes it equal distance for everybody who's then out on the outlying area, rather than what we tend to be doing with all of our services in the Champaign-Urbana area, and that's putting them on the perimeter. And now we're putting housing in the center, so it's sort of just
inverted.
Inverted. So those people in East Urbana, if they go to Christie Clinic, then we'll have quite a distance and challenge to get to the western part of Champaign. This sort of leads me into thinking about ways to leverage with Christie, and you were talking about means of transportation, and that is negotiating paratransit being provided by Christie for people, so it isn't such a going to the corner and standing on the corner for the bus for 15 minutes, getting on the bus, and then the very circuitous routes to get out there to help minimize some of that, or maybe some delivery services to get medication to the people after the fact, or results to people so that they don't have to make a second.
Sure. Look, so many people go to Christie to use the pharmacy because it's centrally located. That's another
That's right.
function.
There's no drugstore in downtown Champaign, so it certainly did service that, didn't it?
And actually, Christie 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 Pharmacy works closely with Francis Nelson Community Health Center. A lot of times the scripts that are written by Francis Nelson physicians are over at Christie, and patients get a discount. They have an arrangement where patients get a discount.
Okay, I wasn't aware of that. All right.
So in fact, a lot of low-income people need that
so
Christie
that really
Pharmacy.
does create a void.
Yes, if they're then going to have to go out to that intersection of I-57 and I-74, a lot of people are going to have a very hard time. Some alternate arrangement is going to have to be made. This is going to have a huge impact. I mean, it's just going to have a huge impact. And I think what upset me when I read about it is that all of the justification for doing it was based on something other than what is best for this community and
the
what
whole
is
safety and welfare of our community.
Yeah, and even the existing Christie patients. There was no articulation of a rationale for doing it to make things better for those folks. And I think ultimately, whether healthcare providers are for profit or nonprofit, they operate by the grace of the community, and they earn goodwill from the community. And, I feel that they are obligated to the community in a certain way because, in fact, healthcare is not like any other business or service or purchased good. It really is not. And so
usually we have very little lead time to choose.
Yeah, we have little lead time to choose. It's an essential service.
Yes.
And therefore I think it confers upon the healthcare provider greater ethical obligations to be responsive to the community and not just be about a business. And frankly, when the healthcare providers like Carl Clinic and Christie Clinic say, well, we're a business, you'd be hard-pressed to find another business, some other type of business who is so unresponsive to its clients, than sometimes healthcare providers are. It's like they forget that they are actually in the business of providing health care.
Well, it's sort of like the university exists because the students come there. It wouldn't be there for any other reason.
Right.
And healthcare systems are basically the same way. I don't want to slip by giving you the chance to talk about the new location of Francis Nelson, and then a Walgreens has been built at that corner. Is that going to help facilitate some of these logistics we've been talking about? People, well, it's harder for them to get out there. Well, you'll tell the location, but then I'm thinking once they're there, just sort of walking across the parking lot to the Walgreens. So how is that going to work out for folks?
Well, that might work out nicely. That might even give the opportunity for an innovative local collaboration between Francis Nelson and Walgreens for discounted prescriptions. I don't know if that's in the works or not, but that would certainly be lovely, right? And the new location for Francis Nelson is in the shopping center that's on the corner of Bloomington and Prospect in Champaign, and it's going to be in the
old Eagle grocery store.
Oh, I heard it was a furniture store.
Was
it after that? Was it Leaf?
Yes.
Furniture?
That shows how long I've lived here.
Okay.
But I knew it was an Eagle grocery store.
People always use as a reference, whatever it used to be, and I kept on hearing about the furniture store.
Right.
Yes, that's where it's going to be, and it would have been much more visible without the Walgreens there, but now the Walgreens is sort of the landmark, and behind that is where the Francis Nelson Community Health Center will be there, and it is expanding. It's something that the community, we definitely encourage the community to support. I think it's wonderful that it's expanding. I do feel compelled to say, however, that even with the expansion, it will not begin to make a dent in the crisis of access to care unless Carl Clinic and Christie Clinic also start opening their doors. Because with the Francis Nelson Community Health Center expansion, they currently serve, right now in their current location.
And why don't you, for those who aren't aware where that is.
Okay, they're on Carver Drive, which is it's just north of, it's off of Bradley.
Right.
On Carver Drive.
In a very isolated.
It's sort of a residential
totally residential. There are no
Yeah.
other services in
No.
that area.
No.
That's right.
But it grew out of the community, and that's where
It
it
grew out of the community.
It's
It
got a
did.
beautiful history, actually.
It does.
But they currently serve approximately 5,600 individual patients, and the expansion will allow them to serve an additional 3,200 and some patients, bringing that up to a total of about 8,800 patients.
Okay, say roughly 9,000 patients.
So roughly 9,000
patients.
patients. And remember that earlier when I had talked about the lack of access to care and that we have about 40% of the population affected, that's about 76,000 people.
Right. You
so
said
we're
it
still,
was out of 189,000,
yeah.
correct?
So we're still going to have, and I'll be conservative in saying this, 50,000 people, 50,000 community members still with no meaningful primary care access. We will still have a crisis, and that's still an enormous crisis. Francis Nelson expansion is necessary but not sufficient for addressing the crisis. There is no way in our community that without Carl Clinic and Christie Clinic opening their doors that this crisis can be significantly addressed. Carl Clinic and Christie Clinic have to be part of the solution. They have to start opening their doors to some of this population, and they should do it in coordination with Francis Nelson. And I mean, healthcare providers in other communities figure out how to collaborate, where certain patients go to one place, maybe because that place has doctors who can take care of certain kinds of conditions, or whatever it is. There needs to be a collaboration and coordination for how to serve all of our community members.
Well, that actually opens up two other thoughts that I wanted to see that we talk about. One is there any opportunity for collaboration with our public health, and is that facility or that entity, I should say, another finger in this this hole in the dike, and then what are other communities doing? Now,
Sure.
you drew the picture that we are extremely unique,
Yes.
but other communities do have similar problems, so are there places we can look to for some ideas?
Sure, and we can even look to our own community for some ideas. We have some very innovative programs here as well. But I'll start with talking about the Champaign-Urbana Public Health District. I'm actually very excited about the Champaign-Urbana Public Health District becoming really a major player and a leader in our community health situation. There is a new administrator there. He started in January, and his name is Vito Palazzolo, and he is very quickly becoming oriented to the community and to the needs of the community. And one of the things that has already been announced that Champaign-Urbana Public Health District is going to do is, which I think is incredible and very much needed, is that they are going to expand their dental clinics to serve adults in our community.
It's only been children
It's
all
only
the
been
years.
children all the years, and there's been so much turnover of dentists. Previously, Champaign-Urbana Public Health District has had a very difficult time keeping dentists.
It's been very unstable.
It's been very unstable. And I think that now with good leadership at the Public Health District under Vito Palazzolo and the Champaign-Urbana Public Health District Board of Directors, who have approved this expansion, I think we're going to see great things ahead. And providing dental services to low-income adults in our community will be a huge help. This is one of the major health crises that we have in our community. Every month, Healthcare Consumers receives probably about 400 calls to our consumer health hotline, people who need some kind of care or are having some kind of problem with the healthcare system, and easily over half of those calls are about adult dental care and
Really?
needing to access
Wow.
adult dental care. It's a huge crisis, and it's a crisis that shows up in the emergency room, so the hospitals are aware of it as well.
With an infection or
Sure.
okay. I
Sure.
see.
And so this is just this is going to be a real tremendous improvement for our community, and it's something that I'm very excited about, and it's something that Vito Palazzolo and I have talked about since the moment that he got here. And I give him and the Champaign-Urbana Public Health District Board a lot of credit for envisioning this possibility and being willing to do it. we have a very innovative program in our community actually already around dental care, which is the Child Dental Access Program, which is for county children because they were not being served through the Champaign-Urbana Public Health District. And so through community organizing, we were able to develop this model and convince the County Board of Health to adopt it and take on this program, and they in turn asked the Champaign County Board for funding to fund this program, and the program has been around now for about 4 years, and it's incredibly successful. The program works with a coordinator, Lisa Bell, who is a dental hygienist, and what she did is she went around the county and she recruited dentists to participate in the program, where they agree that they will see county children, low-income county children, and give them care, and they will get reimbursed at 50% of their usual charges by the county. So the families of the low-income children don't have to pay anything, and they can't afford to, but their children are getting dental care. And prior to this, we were having 2- and 3-year-old children who needed root canals, which is a measure of the severity of, lack of oral health and basic
oral hygiene.
Yeah, and now we're seeing children who are coming up for their, they're keeping up with their 6-month checkup appointments, and the oral health education that's been done and the care that's been given is paying off. They're showing up without any cavities that need treatment and so on, and some children have been in the program for several years. So this is a program that really pays off, and it was innovative in terms of saying, sort of like what we were talking about earlier, how can we have a program that not only meets the oral health needs, and we have dentists who provide the services, but where we reduce the transportation and the distance barriers, and we do that by engaging the dentists who are out there, who live in those communities where the families come from, and ask them to participate and serve their communities. And about a third, I think, of all of the dentists in our community have been participating in this program. In our county. In our county. And so it's this wildly successful program, and the model, the idea of this collaboration and somebody coordinating this and screening the children and getting them in and working with the providers to make it easy for them is a great model that can be used for almost any other type of health care.
Just again, for our viewing audience, if I'm in this kind of situation, how do I find out about the program? Where do I go?
Okay. Well, actually, one thing that we do at Healthcare Consumers is we have a tremendous number of resources, and to find out about that program or other programs, depending where you live, you may be eligible for different things. The best thing to do is just to call us at our phone number. But we also have resource guides that we can give to people, and I'd like to put those up.
Yes, please do. And again, there's the website up there.
Yeah. And I don't know if this will all fit on there, but this is a copy of one resource guide that we have. This one is called Healthcare Resource Guide, Options for Affordable Physical and Dental Health Services. So the dental programs are listed in there.
Okay.
And we can give these to anybody for free.
And why don't you mention where you're located?
Okay, we're located in downtown Champaign in the Lincoln Building at 44 East Main Street, and our phone number is 352-6533. The other resource guide that we have is for behavioral health, and this one focuses on options for affordable mental health and substance abuse services. And if people want a copy of this resource guide for themselves, or if they're a service provider and they would like to distribute them to clients, we have plenty of them to share. It's just a community service that we do, and actually we got some funding from the Village of Rantoul and from the City of Urbana to produce these resource guides.
And just, we've been talking about transportation and ease of getting to facilities, and your facility is located not far from the transportation centers. So those who use buses to get around can easily get to your offices.
Yes.
We have only a few minutes left, unfortunately.
Okay.
We've covered much of the ground about healthcare in our community, but I don't want to leave any stones unturned.
Okay.
So are there any topics that you want to touch on very briefly?
Sure. Very briefly, I would like to talk about the Part D program under Medicare.
Okay.
This is a huge huge issue, obviously a national issue, but it plays out in communities because Medicare beneficiaries are trying to figure out this new so-called prescription drug benefit.
It's a challenge.
It's horribly flawed, and we are actively working to try to get Congressman Johnson and our senators to work legislatively to completely revamp this program.
Okay.
And people are being harmed by it. They're paying more and getting less,
Yes.
and it's a mess. And one thing that we have, if people are interested in learning more about this, we have a lot of information on our website that
Okay.
people can go to. But we are also out at the farmers market and wherever we can collecting signatures
Okay.
for a petition that I'd like to share.
The last petition to share.
Yes, this is the last petition to share.
Okay, excellent.
And basically, what we're calling for, and so are many organizations around the nation calling for the same thing. We want a real Medicare prescription drug benefit that will be easy to use. We think that Medicare beneficiaries should be able to go to the pharmacy and show their Medicare card, just like they do at the hospital or at their doctor's office, and that should be their prescription drug card, unless they want a private plan. But most do not.
That's another choice.
That's another choice. We
Choice.
want them to have the choice. We want the plan to be administered by Medicare because they do it better. We want the government to be able to negotiate discounted drug prices on behalf of Medicare beneficiaries.
The
which,
fact that they didn't put that in.
well, not only did they not put that in, the law actually prohibits
Prohibits it,
them
yes.
from doing that, which is simply, it's insane, except for if you follow the money and you think, who does this benefit? And it benefits private insurance companies and pharmaceutical companies,
Yes.
but not the people. And then the last thing that we want as part of that is guaranteed coverage, that it should cover all needed drugs at predictable, uniform cost without coverage gaps. It's very simple. So we're working very hard on this. We have a Medicare task force that is out there organizing, that has about 30 to 40 community leaders who are Medicare beneficiaries who are becoming active on this issue, and we're part of a national network focusing on this.
That's excellent, and actually that's a second great master's topic for a health administration student to cost out
Yeah.
the amount in time and effort that it has taken people to figure out these plans, only to then sometimes get entrapped in a plan that they can't move from, especially if for some reason they're ill and they have a new medication prescribed, which they didn't have at the point they made their
Right, their
judgment
decision.
and
Yeah.
their decision, and then they're just
Left holding the bag.
they're left holding the bag literally.
Yeah.
And
Yeah.
it might have been all right for them, but
Yeah.
then again, it might be costing them a tremendous amount.
I seriously predict, I'm not saying this tongue in cheek, I seriously predict that if this doesn't change the way that things are going right now, with also the donut hole,
Oh,
which
yes.
is a huge gap in
Yes.
coverage,
Yes.
that people's lives will end too soon. People who need medication for chronic health conditions and they're not able to get it. We already have clients who are hitting that donut hole where they have to continue to pay for their coverage, but it doesn't cover their medications and they are already
People
going
don't
without.
have $5,000
That's
to
right.
fill that donut hole, and what we've done is just push that
Yes.
limit and push that limit. So as you have said several times, and just to underline what you've said, we've created a major crisis, and it's sort of like what's happening in nursing homes.
Yes.
When people get into a nursing home, they're much sicker
Yes.
than they were 10 years ago.
Exactly.
Because it's
Yeah.
just been pushed and pushed and
Yeah.
pushed further away.
It's a nightmare.
It's very serious, and it certainly is clearly an intersection between community planning and health planning. Claudia, thank you so
Oh, thank you
much.
so much.
You have helped everybody in the community have a better understanding of what is happening not only in our community, which seems to be skewed slightly due to our statistics, but certainly is happening nationally. And remember, planning matters.
That's right.